Researchers say it's a condition that impacts more than 5 million adults in our country. But our next guest says that there's a new help to those out there who are living with bipolar disorder.
So Dr. Gary Sachs is an associate clinical professor of psychiatry at Harvard Medical School. I spoke with him earlier this morning to get more information about a condition that he says affects millions of Americans.
Well, bipolar disorder is diagnosed when patients have had an abnormal period of mood elevation. And bipolar 1 in particular means that people have had either a full manic episode or what we call a mixed episode, meaning they've had the symptoms of mania along with depressive symptoms. When that happens even once in a patient's life, they get the diagnosis of bipolar 1.
And how
so it's a very common condition. Yeah.
How does that affect someone's lifestyle?
Yeah, these are really impactful conditions because even though we diagnose them based on the mood in particular, mood states like mania and mixed are accompanied by a host of other symptoms that affect energy, sleep, appetite, judgment, and cognition. And so it can be very difficult to sustain relationships and work if you're having one of those episodes. So that can lead to people leaving school, losing their jobs, losing relationships. And it's an extremely important thing to recognize before it gets out of control. Fortunately now that there are treatments that are highly effective, and the good news is that they're becoming easier to take and to tolerate, so we're treating more and more patients effectively. And that's why I would encourage anybody who's thinking that they might have a condition like this as early as possible to seek a professional assessment and get into treatment.
Well, that was going to be my next question. When does someone go see someone such as yourself? And then what are those treatments?
Yeah, you know, I think the sooner you get a formal diagnosis and entertain the treatments, your chances of getting better go way up, so I really encourage that. The treatments that we have available for these manic or mixed episodes, it's important to recognize that there is no talking therapy that even claims to be effective for those. But we do have these highly effective medications. There's FDA approval, as there has been for a long time, for lithium, a couple of drugs that are anticonvulsant drugs, but now about half a dozen drugs that are referred to as antipsychotics because they were first approved for schizophrenia. But these drugs have been proven to be highly effective for treating manic and in some cases mixed episodes. The most recently approved is a drug called Vraylar, and this is a drug that got FDA approval because it's been shown to be superior to placebo in controlled trials. Now the important thing to understand is that these are very potent drugs and they need to be prescribed by somebody that knows what they're doing, and we have to recognize that when you prescribe potent drugs you have to be on the lookout for safety issues. So as you see on all those television commercials, yeah, we worry about the elderly. In the dementia population, things like stroke and even death can occur. So we need somebody who knows what they're doing when they prescribe these medications.
And last quick question, if someone wants to do research on their own, where can they go do that?
I'm all for self-assessment, especially when it leads to professional assessment. So one of the best resources is the Depression and Bipolar Support Alliance. And you can go to their website, it's dbsalliance.com, and you'll see their great resources there.
And a special thanks to Allergan for sponsoring that segment.